All right, today we are tackling one of the biggest, if not the biggest, time sinks in all of medicine, creating the treatment plan. We're going to break down how you can take this huge daily burden and turn it into a super streamlined, efficient workflow that honestly gives you back hours in your week.
Right now, for most of us, this is the reality. 15, 20, sometimes 30 minutes for a single patient just to research, write up, and document a good, evidence-based treatment plan from scratch. Now, multiply that across a whole day's worth of patients, you can see how the hours just vanish. And look, this isn't just about the clock. This 30-minute treatment plan is a huge source of cognitive load. It's this constant, demanding task that, let's be honest, is a major contributor to burnout. The mental energy it takes to do this over and over and over again, and to do it well, is just enormous. So why does it take so long? Well, it's because it's so much more than just picking a drug, right? You have to pull up the latest guidelines, you have to think about second-line options, you've got to factor in the patient's unique history, their comorbidities, their other meds, then you have to define how you're going to monitor them, figure out the key education points, and schedule the follow-up. It's an incredibly complex puzzle for every single patient. So, this brings us to the big question. Is there a way to fundamentally change this? Can we actually take a process that eats up hours of our day and shrink it down to just a few minutes, all without sacrificing any quality or safety? Well, the answer is a resounding yes. And it all starts with this idea, a universal treatment plan prompt. Just think of this as your foundational blueprint, like a structured template that you can adapt to pretty much any clinical scenario to get a fantastic, comprehensive first draft from your AI assistant. The very first piece of this blueprint is defining the who. We're giving the AI a quick but really detailed snapshot of our patient. Age, comorbidities, their med list, allergies, and those crucial little factors like renal function or even insurance issues that can totally change our plan. The more specific you are here, the better the output's going to be. Okay, next up, we define the what. This is the clinical problem itself. What is the diagnosis? How severe is it? Is this an acute thing or a chronic issue? And this is critical, what have we already tried that didn't work? Giving it this context stops the AI from just suggesting things you've already done and really focuses it on the next best step. And now for the magic, the command itself. See, we're not just asking for a plan. We are telling it to generate a structured output with these 6 specific parts, from first-line therapy with the evidence cited all the way to a clear follow-up schedule. This forces the AI to think methodically and give you back a complete, organized, and useful document. Okay, so that all sounds good in theory, but how does this universal blueprint actually hold up in a messy, complex, real-world situation? Let's put it to the test and apply it to managing a chronic disease like type 2 diabetes. So have a look at this. On the left, you've got those general categories from our blueprint. But on the right, you can see how we fill them in with very specific clinical data for a diabetes patient. Comorbidities become specific conditions like ASCVD or heart failure. Disease severity is defined by an actual HbA1c. We even tell the AI to stick to the specific ADA guidelines. And this is the game changer. By feeding it that level of detail, the AI's output is totally transformed. It's not just some generic summary of diabetes care anymore. It's a clinically useful draft that recommends specific drug classes, like an SGLT2 inhibitor for a patient with heart failure, and it tells you why by citing the ADA standards. Now, getting all this speed is fantastic, but it means absolutely nothing if it isn't safe. This is where your clinical judgment becomes more important than ever. So let's talk about the quality control process that has to go hand in hand with this workflow. Before you even think about finalizing an AI-generated plan, you have to run through this mental checklist every single time. Does this plan actually match the diagnosis? Are all the safety checks, like allergies, accounted for? Is every single dose correct for this specific patient? Are the guidelines it's citing actually current? You are the final safety net. I really can't say this enough. This is the single most important thing to remember about safety. AI models can, and they absolutely do, make things up, especially precise numbers like drug dosages. You must always verify dosing, interactions, and contraindications using a trusted, independent source. The AI is your assistant. You are the one signing the chart. So, when we put this powerful blueprint into practice and we layer on those essential safety checks, what's the actual result? Let's bring this all back home and look at the real payoff. Remember where we started? 15 to 30 minutes? This is the new reality. 3 to 5 minutes. That's what it takes to get a high-quality, evidence-based, patient-specific draft that's ready for your expert review and final sign-off. I mean, the numbers here really speak for themselves. We're talking about a drop from an average of over 22 minutes per plan down to just 4. That is a colossal gain in efficiency. It's a fundamental change to how we handle this part of our day. And let's be crystal clear about the goal here. The point of all this is not to replace your clinical expertise. The point is to get rid of the tedious, time-sucking administrative work of drafting a plan from a blank page. This lets you focus your precious time and mental energy on what really matters: high-level clinical thinking and actually caring for your patient. So, I'll leave you with this question to think about. When you reclaim these hours from paperwork, what becomes possible? Is it more time to connect with patients? More time to think through complex cases? Or maybe, just maybe, it's getting home to your family on time. A workflow like this doesn't just change your documentation, it can change your entire day.